Right, a warm welcome to this Teach to Reach plenary session on the health impact for local communities. We're going to be deep diving into climate in relation to neglected tropical diseases. Now, this does not exclude that some of the Teach to Reach attendees will share stories that are first about neglected tropical diseases, but we'll still ask you the question about climate and its impact. We're proud to be presenting this session in partnership and with the support of Uniting to Combat Neglected Tropical Diseases, which is our partner. We met last week, or actually 2 weeks ago now, with Toko Elfikpuli, who is the Chief Executive Officer of Uniting to Combat Neglected Tropical Diseases. Here's what she said about partnering with you health professionals participating in Teach to Reach. When she says partnering with Teach to Reach, it opens up a vital channel for us to hear directly from you, from frontline health workers, about the challenges you face and the solutions you are pioneering. Your experiences must guide our collective efforts to beat NTDs in a changing climate and achieve health equity. And you can read more on the Geneva, on the Uniting to Combat NTDs website on why and how we've partnered to really try to amplify the voices of you, participants and attendees in Teach to Reach health workers, but also we've heard a number of researchers, educators concerned by these issues. So we'd like to kick off now this session, the very simple prompt. Think about one neglected tropical disease that affects your community. Tell us about a time when you tried to help people with this disease. What was the situation? Who was most affected and why? And what did you do to help? We're going to lower all attendees' hands as this is a new plenary session. I also want to acknowledge the many messages in the chat already dealing with climate change, which was in the previous session. Unfortunately, we won't be able to get to all of these, but we're looking forward to this, your contributions on neglected tropical diseases in relation to health. Charlotte, do we have any hands raised? Okay, I see already. Yes. And so please be specific. Again, we're looking for your personal experience, not general considerations or your opinion about these diseases or how bad they are, but about really a time, a situation when you did something. Tell us about the situation and tell us what you did and how it turned out. So let's go back to Joanitor Nasima, whom we heard in the climate and health session, and then also from the immunization side of the house, Ndayo Iwat, if you have a contribution specific to a neglected tropical disease that affects your community. Ndayo, we haven't, Joanitor has not responded, so please go ahead.
Thank you, Reda. Thank you, everybody else. Yes, Dr. Ndayo Iwat. I'm in a Federal Capital Territory of Nigeria, and I operate in Kuje Area Council. I'm being specific because of my direct experience with the community, Chibri community in Chibri Ward, in Kuje Area Council of the Federal Capital Territory of Nigeria. We demonstrated an incidence rate of urinary schistosomiasis, bilharziasis, of 9 out of 10 persons in that community, from the village, from the community leader to the school children in the primary schools. We were able to analyze their urine, and I went ahead with my team to do stool culture and microscopy, and we found out they did not have the intestinal schistosomiasis, but they were all having urinary schistosomiasis, that is schistosoma hematobium. And we also did culture to isolate other secondary infections, and I'm glad to say that not many of them had secondary infections. But terminal hematuria was the presenting symptoms, and it was a chance finding in a primary school when we went to give them health talk on nutrition, and the teacher told us that some of the pupils there were having urine in their blood, and they were taking it as a normal thing for children that are up to 10 years, that they are reaching puberty. So having knowledge of what hematobium schistosomiasis is, I had to quickly assemble a team, and we got into the community and we did the screening test for them. And I want to say that they have been taking praziquantel on their own. They will go to the pharmacy shop, they will buy that, and they will take that and feel that they were fine. And some of them did not even have to go for treatment. So when I explained to them the sequelae of this infection, leading to even cancer of the bladder and other chronic inflammatory reactions in the bladder and the urinary tract, they were so worried. And I linked it up with the government. We got approval to assemble a multidisciplinary team from the sensitization agency to vector control agency in the water board and the primary healthcare sector, the community. So we got the approval of the minister to put that in place so that we can do vector control and we can also expand access to potable water to the community, not just with circulation to the community, but right to the households, so that householders who are used to going to the stream should be able to have water right in their home and be discouraged from going to the stream. And I was also able to establish that the freshwater snails, there's millennium snails coming from the Lower Usman Dam, that is the major source of water to potable water to the Federal Capital Territory. The environmental impact assessment was not made known. I advocated for that so that they can redo that and let government take full responsibility for what is happening, because we also confirmed that almost all the communities living along the river banks of the fresh water from the dam are having this problem. As I speak to you now, actions have not been taken to address this issue. And I'm looking for partners. I know that the Geneva Learning Foundation has encouraged us to go to websites and look for people that are working in this area. So urinary schistosomiasis is real and is demonstrable in communities in Federal Capital Territory of Nigeria, living along the river banks of Usman Dam, flowing down to the ocean, to the river Niger in the Middle Belt. Thank you so much. I will stop it for now.
Thank you very much indeed, Ndayo Iwat, for sharing this very comprehensive and specific experience. Joanitor Nasima has just unmuted a microphone. Please go ahead. Can you tell us which neglected tropical disease you'd like to you have an experience that you'd like to share about? All right, I think Joanitor is still having problems. It sounds like your microphone, maybe there's a wire that's not connected properly. Let's try a few more seconds before we go to Caroline Charles.
Yes, thank you so much.
Unfortunately, Joanitor Nasima, you are breaking up, so I'm going to have to mute you for now. Please see what you can do to fix your connection, and we're going to go to Caroline Charles. Caroline Charles.
Thank you very much.
Don't forget to introduce yourself. Tell us which neglected tropical disease is you'd like to you have an experience with, and then tell us about a time when you tried to help people with this particular disease. But do introduce yourself first.
Okay, thank you very much. So I am Caroline Charles, and I'm based in Abia State, southeast of Nigeria. So just like we are talking about, I picked interest in diabetes and hypertension, and this interest came up when we did a project we called the SSN project that was funded by the Novartis. Right, then I was working with Society for Family Health.
Sorry, unless I'm missing something. So diabetes and hypertension are non-communicable diseases known as NTDs. Here we're talking about neglected tropical disease. So is there a connection to NTDs with you in your experience, or is this a experience unrelated to NTDs, which we're talking about right now?
Okay, sorry, I think so. That's a mix-up then.
Okay, no worries, Caroline. So if you'd like to learn more, and these are neglected diseases, which means that many health professionals do not know about them and do not understand how they are different, say, from non-communicable diseases. What you can do is, I encourage you to go to our partner's website, Uniting to Combat Neglected Tropical Diseases, and you have a disease directory. So NTDs include bilharzia or schistosomiasis, Buruli ulcer, Chagas disease, dengue and chikungunya, echinococosis, elephantiasis, foodborne trichomoniasis, guinea worm disease, intestinal worms, leishmaniasis, leprosy, mycetoma, noma, rabies, river blindness or onchocerciasis, scabies, sleeping sickness, snake bites, tenesis, cysticercosis, trachoma, and yaws. So that's the current list of neglected tropical diseases. They should not be confused with non-communicable diseases. Thank you so much for sharing. Joanito or Nasima, have you been able to fix your microphone? We'd love to hear from you. Which neglected tropical disease are you interested in sharing?
She seems to be connected on 2 devices, Reda.
Okay. All right, Justine Namuli. All right, Justine is yes, Justine, which neglected tropical disease do you have an experience with?
Rhoda, I think it is a neglected tropical disease that does not even appear on the list, which is mumps. Mumps, whereby we have swelling in the jaw. And it's really painful among children, even the adults, most of them get it. And when they get it in Uganda, we don't really have a real treatment or real cure. So when we first, because of the way we serve the community using telemedicine technology, internet, and digital channels, we have been having conversations with the community health champions on phone. And in Uganda, it reaches a season when the mumps are so rampant. And when they go to the hospitals, there is no real treatment. So we usually treat the causes. We usually treat the signs and symptoms like the pain. So we could give painkillers and something to handle the symptoms as they stay with the disease for some time. And after some time, it cures. So basically, that is what you have been facing. You have not really been giving them the real help. Yeah.
Understood. All right. So I just looked it up. So officially, mumps is not classified as a neglected tropical disease, but there is an argument, as you say, that it's certainly a neglected infectious disease in some cases. And I think this is what you are alluding to. Now, just to ground our discussion in what participants shared ahead of the session. And Joanito still has a problem with a scratchy microphone. If I could ask Maria or Charlotte to mute her. Yeah, thank you. So you can see here, and perhaps it'd be good to check if any of these folks are in the room. So Ndasi Downey Vicky shared a story about Buruli snails and schisto. Chuchu Trukodake said supported a woman with lymphedema. NTDs, again, a testimonial for Mary Aisi. Charles, Caroline. All right, so yes, indeed, this made it into the NTD, but I think that's a confusion between NCDs and NTDs. There are a lot of acronyms in health. Lucy Oyoma Adebayo here has a testimonial as well, so maybe we can find, and of course we've heard actually from the lightning chat and Duka Ozor's story. All right, Rebecca Bello on FGS. All right, so maybe it looks like these diseases are neglected.
I had my hand up.
Yes.
I will take
Charlotte, I'm going to turn back to you because it seems like there's several microphones unmuted. Can you help us sort out? And we are looking specifically for someone who has an experience to share with neglected tropical diseases, which tend to affect the most marginalized communities. And perhaps that is why such experiences are more difficult to surface than, say, on malaria or climate change and health in general. Charlotte, have you found someone who actually shared an experience that is on NTDs, not on something else, that we can call on?
Yeah, I have one there.
Okay, Margaret, if we can hear from you before we turn to Osigno Akpere.
Thank you very much. Thank you very much, Charlotte, and our chair. Thank you very much once again. This is my second opportunity to talk today. It's very, very, very encouraging. I'm Dr. Margaret Nabagalantambazi, one of your guest speakers today. I'm very happy that I have a chance to share about these neglected tropical diseases. The first time I was talking about malaria and how I shared that communication about the climate change. and how it affects in Uganda, a lot of malaria cases. Now, regarding the tropical diseases, neglected tropical diseases, I want to share one line about the intestinal worms. A lot of intestinal worms, especially threadworms and roundworms, affect the under 5s in Uganda. And why? Because these children do not really have a lot of, they don't have a lot of knowledge about how to prevent worms into their bodies. For instance, when they eat fruits like mangoes, like guavas, they just pick mangoes from down the tree. They just eat without even washing them. Much as we always encourage them to wash the fruits before they eat, especially those which are eaten raw. Of course, as children, when they're hungry, they don't think about looking for water to wash, for example, mango that fell on a tree in a dirty environment. So when they eat them, definitely these worms, they enter their bodies and they're affected already. In Uganda, what we always do when, especially we have like in April and October, when we emphasize a lot about children under 5 immunization and treatment of worms. We give them deworming tablets like mebendazole and albendazole. And also during our immunization sessions, whenever people go for outreaches, they have all under 5. They give them deworming tablets, and this is how we are trying to lessen the cases. Otherwise, there are many and they are stringent, and we always do health education talks in our patient department on how to deworm children, whether they have or they don't have these worms. We try to prevent them by deworming them routinely. Thank you very much. That's what I wanted to share about the neglected tropical diseases and how to prevent them. Over to you. Thank you very much once again.
All right, thank you. And we still have some.
Thank you so much, Margaret.
Yeah. Go ahead, Charlotte. And we did have. Yeah, Charlotte, we did have some very specific questions around community engagement and local solutions. So if you are one of the few, I think, who is here amongst our guests of honor or online listening in, who has actual experience with responding to neglected tropical diseases, if you would like to share an experience on community engagement and local solutions. So this was a time when the community was more involved in prevention, detection, management of an NTD. What helped you involve the community and how did it turn out? So make sure you're referring to neglected tropical disease. On mass drug administration. If you've been involved in what's called an MDA, we're interested in hearing about how confidence in MDAs has changed since the COVID-19 pandemic. And then if you think that NTD services, if you're directly involved in NTD services, so this is part of your work, then we're interested in hearing if you think this could support detection of new emerging diseases. These are the kinds of questions we asked you in the Teach to Reach questions, but we're realizing why these diseases are neglected is because, and there seem to be very few health workers. Everyone knows about malaria, and that's the next session, but these NTDs seem more elusive. Nika Onwu,
yes, please.
Which neglected tropical disease would you like to share your experience with?
Can I mention it now? Thank you very much. My name is Dr. Onwu. I'd like to talk about my experience around community engagement regarding guinea worm. This was a recent experience from my town in Nso. We do have community meetings, and on a community platform, somebody had gone to investigate a particular village that had reports of illegal mining. And on getting there, he saw the illegal miners and the pool of water. So he was trying to find out what they were doing there. And in discussing with them, they now said there were issues around guinea worm. So that got me my attention. I said, wow, guinea worm. I thought we had eliminated that. So I reached out to the federal ministry, the state ministry, and luckily I got somebody who had been on NTDs and chairing NTDs desk at the federal, Dr. Emuka, and he now kicked off the surveillance team at the state level. So when they went to the village to investigate, they were not allowed to. They had to go and see the traditional ruler and call the community together. They said yes, but there's illegal mining. It's an insecure place, and there was need to also have that discussion with illegal miners to see whether the people will be allowed to go and investigate. So they gave them an appointment for about 2 weeks. And then 2 weeks after, they went there and they were allowed to interview people, get the villagers together, call the community together. And after the investigation, as God would have it, it was not guinea worm. There were leeches in the water. And you have women fetching water from there. Old women were still going in there, and they had so much of that. So the report that was sent back to me was that they saw a lot of, filariasis that was there, and there was recommendation for the drugs that would be taken through the local government to the community. And there was a lot of mass mobilization and education and about the water. And we're now looking at how to have, better water sinking, boreholes, because really we don't have pipe-borne water in most of our communities. As far as illegal mining is still going on, and they've been cancelled about that and the dangers of, the stagnant water that is around there and what it connotes. But luckily, from the investigation from the state surveillance team, it was not guinea worm. That is my experience and how the community was able to look into that, and the community engagement that was involved. It was extensive. Traditional rulers, opinion leaders, and even the illegal miners were involved in that interaction. That's over from me. Thank you. I hope you heard me.
Yes, loud and clear. Thank you very much for sharing that experience. I suggest, Charlotte, we actually go to Jacqueline Ido, who said that she's involved in an MDA campaign in northern Uganda, which eliminated onchocerciasis using ivermectin. So, and then we can go to Pamela and Jeru, who we've already heard from as a guest of honor. Jacqueline Ido, please introduce yourself. Tell us what you do, how you work for health, and where in Uganda. And then tell us which neglect. Well, you've told us which neglect. Yes, go ahead.
Yeah, good afternoon in Uganda. It's afternoon at the moment. My name is Jacqueline Ido. I'm a pharmacist by training. And I've worked with a manufacturer who actually donated the treatment for onchocerciasis for as long as humanity needs it. And this dated back to 35 years ago. And that was MSD or Mark Sharp and Dome. So there was a big and bold campaign by Mark 35 years ago, which identified the need to eliminate onchocerciasis as a neglected tropical disease in the whole world, and in communities that are affected by, the simian fly that causes onchocerciasis. So this drug was donated to all the countries that need it for as long as they need it. And in Uganda, we have had the drug now for 30 years. But an issue was identified in northern Uganda, where in the riverine areas where this fly breeds, there was a need to have that community covered in terms of having chemotherapy for this drug. So they basically gave drug therapy, which was a mass drug administration campaign throughout the riverine areas in northern Uganda where this simian fly breeds. So that entire community was covered by 1 tablet of ivermectin, and that mass drug administration was championed by the president of the country, who realized what the problem was. So the president was available and on hand, and he officiated at the mass drug administration campaign, and that whole community was covered. And I'm glad to report that 10 years later, after that MDA was initiated, there is no more onchocerciasis in Uganda, and this was declared by WHO. So it's a very big and bold campaign that has been successful in Uganda, and I would encourage other communities that have this kind of challenge to glean from some of the experiences of the countries that have managed to eliminate this kind of debilitating disease that causes river blindness and severe scarring of tissues, of soft tissues of the skin. So I'm just kindly requesting that if in this Teach to Reach we can reach other countries that have onchocerciasis, then an MDA approach would do well to eliminate that disease in their communities. Thank you.
Thank you very much indeed. The prospect of eradicating a disease, especially a neglected tropical one, is, I think, a story absolutely worth telling. Charlotte, we have a number, so we have 5 minutes left in this session. Let me just go check the schedule here. And if we can mute, if I can ask Maria to mute whoever's microphone is scratchy. We will be at the top of the hour. We'll be going into the next session, which will focus on ending malaria together. So there we're really looking forward to health worker insights on innovation, equity, and impact. And that is what we'll be doing 5 minutes from now. So I believe, Charlotte, we may have time for one person, maybe two, if both are concise, before we go into the discussion on malaria.
Definitely, Reda. I was asking Pamela and Jeru, who was unmuted earlier on. And please do check your microphone, ensure it's working well, it's not scratchy before you raise your hand and unmute yourself. Pamela, are you able to unmute very quickly? Okay.
Yeah. Okay, thank you very much. Pamela Njero from Kenya. And I'm happy to be in this forum today to discuss about the neglected diseases in Kenya, whereby one of them is rabies. Recently, we have had an outbreak of rabies, whereby the community do not know or understand what is rabies. Even some cows around the community had rabies because they were bitten by the dogs that had rabies. And some of the people around there were slaughtering the cows. And that was a problem in the community, whereby I raised an alarm about the situation in the community, in the county government where I belong, because in Kenya, we have counties. We have the national government and we have counties. As a champion around that community, I discussed the issue with the people that deal with that problem. And we had to organize how to have a training of champions in that community so that we can deal the situation in my area. So we had a training of around 5 days, trained around 50 people who are going around the community, training the people in the community about rabies and how the symptoms of rabies, how to deal with an infected dog or cow or person, because most of them do not know all the symptoms of rabies. And now we are still in the process where I'm also involved so much. I go around the community, checking around the dogs, checking the cows and the people in the community, getting information if there is something not normal in the community that is happening to people, and also the people in the community, the dogs, whatever that may, even the goats, if they are bitten by the dogs with rabies. And we are trying now to see what can we do to reduce this pandemic that has come in my area. Rabies has been in my community, but not as much as now. And in Kenya also, there's nothing that people discuss about rabies. Even the injection for rabies is rare. So if a person is bitten by a dog that has rabies, he or she is likely to die because even the injection is very far and very expensive. So I'm involved in that campaign, and that's why I felt it's good that I share where I am involved about rabies. And I hope maybe by the end of this year, we will have sensitized the community. The government will have taken up I'm advocating also for the government to bring the vaccination or the injections around the facilities we are near the community so that we don't risk losing people. And also the veterinarians to be around to sort out the problems of the community with the cows and goats that are being affected with rabies. So that is what I wanted to share with this great team.
All right, thank you very much indeed. This was a challenging session. You can hear neglected tropical diseases in partnership with Uniting to Combat Neglected Tropical Diseases. Thank you again. If this leaves you thirsting for more, if in particular, if you were not able to share the experience that you have with a specific neglected tropical disease, if you have questions about NTDs, we urge you to do two things. One is go to the Uniting to Combat NTDs website. This is where you can check, is what I'm concerned about a neglected tropical disease or not? That's the first checkpoint, and then you can learn more about them. Second is you to go into the networking, because there in networking you'll be able to share your stories for Ernest Boateng, or for Gifty, or Iya Abdul Kadir, who had very specific experiences to share. I urge you to go to the networking. Again, it's very simple. You click on networking on the Ring Central Teach to Reach Connect 10 platform. Click on join now, and then click on join, and that will match you up with someone else in the session.